Welcome to the 2023 Queensland Medical Recruitment Webinar Series, Episode 2, Preparing for Success, CV and Interview Tips. It's great to see so many enthusiastic medicine students and junior doctors across Australia joining us in this event. My name is Andrea Muller and I'm the Program Manager of the Northern Queensland Regional Training Hubs. Today I will be the moderator of this webinar. I would like to start by acknowledging the traditional custodians of the land where we live and work and pay our deepest respect to their elders, ancestors and future generations. James Cook University's Northern Queensland Training Hubs is proud to be hosting this event tonight. However, it would not have been possible without the Commonwealth Department of Health, who fund the Regional Training Hubs program. Additionally, this was only possible through the collaboration and support of Dr. Ash Coxon from Medical Career Planning. We have an exciting program ahead. Ash, a general practitioner and a career counsellor and founder of Medical Career Planning, will be talking about career statements or how to identify which skills you should include on your CV to enhance your application success. Also, we'll learn tips and tricks for preparing for medical job applications from intern to entry into specialty training pathways and how you can ensure that your CV fully reflects your skills and experiences. After that, we will open the conversation up to questions from the audience. At the bottom of your screen, you can see the Q&A icon. Please use this tool to ask any questions, and at the end of the session, we'll have the Q&A session. But please welcome Dr. Ash Coxon.
Thank you, Andrea, for that wonderful introduction. And thank you, everyone, for coming along tonight on a Thursday night. When I'm sure you probably would love to be sitting on the couch watching MasterChef or something along those lines. But no, it's great you've come along. It's obvious that you're really invested in your career and that you're really hoping to get some great tips from this session, which is what I'm hoping to deliver. So I'd like to thank North Queensland Regional Training Hubs for inviting me along to speak tonight. I'm going to speak about an area that's a passion of mine, which is career development. And the guys at North Queensland Regional Training Hubs know I love to talk about careers. So hopefully you guys will enjoy the session tonight. If you have any questions, please pop them in the Q&A box, as Andrea said, and I'll try and get to as many as many questions as I can and give you the right answers. So my background, as Andrew said, is that I'm a GP and I'm a career development practitioner. So I've been a GP for over 10 years now. I trained through James Cook University quite a while ago, and I've been a career development practitioner for 6 or 7 years now. So working with medical students and doctors all around their careers. So that might be how to get onto the training program that they really want to get onto, or what to do if they don't know what they want to do with their career, or how to set them apart from other people when they know that there's a strong competition for a training program, or even some people that might decide they want to change their careers later on down the track. So these skills, which I'm going to be talking to you about today, all around your CV and interview, aren't just important for your applications for next year. This talk that I'm going to be doing, I'm hopefully going to be giving you some tips and tricks to keep in your toolkit for the remainder of your career. Because what we know that we don't do that well as doctors is CVs most of the time, because we're not used to that, right? We've been training to become clinicians, we're scientists, we're doctors, we're used to getting out there and helping people, or medical students who are wanting to do that. We're not used to sitting down and writing a CV that's focusing all about us. And it's very common that I see people feel incredibly uncomfortable writing a CV or sitting in an interview when they feel very uncomfortable to talk about themselves. And that's a really common thing that I hear, and something that I think if you can master the skill of understanding that you're not showing off, you're not being showy about all of your skills, you're actually proving to your potential employer that you are the right person for the job. If you can get your mindset around that and start to see that you have unique skills, figure out what they are, and try to weave them into your CV and your interview, then that's the key to getting yourself onto the training program that you want to get onto, or a position that you want to get, or a consultant job, or transitioning into a different career completely that might end up being a non-medical career. The key to doing it successfully is figuring out what sets you apart from someone else. So what are your unique skills? And that's what we're going to be going through today. So what I'm going to be talking about is what is a CV, how to structure it, and what to include. I'm going to briefly talk about career statements and the importance of those. And we're going to be going through interview tips and tricks, interview frameworks, and more importantly, where to find more information, because these topics are huge. It's very difficult to get everything you need to know into one talk. So what I want you to walk away with knowing is where to find the best information to go about doing your CV and getting the best interview prep as possible. So it's important to us to sort of define this. Is it a CV or a resume? Because people get quite confused about this. So they're often used interchangeably, CV and resume. And you'll find that people might say they want a CV or people might say that they want a resume. Basically, a resume is about the specific job you're applying for, and a CV is more about getting you in general. That's where you start to talk about yourself a bit more. Great motto, when in doubt, leave it out. So the aim of your CV or resume it's all about presenting a summary of your career, including education, professional history, job qualifications, and with a strong emphasis on demonstrating that you have the specific skills for the position that you're applying for. And as I said at the start, that's the key, proving that you have the specific skills that this job wants you. The key is finding out what skills the job wants, and I'll give you some tips on how to do that. So essentially, the purpose of writing a medical CV is to move you forward in the application process, to get you to that interview stage. So you need to have a good one. You need to get to that interview stage if your job is wanting interviews, and writing a good, concise one is really good. You should ensure that your CV is relevant, clear, and concise. What I mean by relevant is don't churn out one CV and send it out to multiple places for 3 years in a row without reviewing it. If you want to have a successful CV, you need to be thinking about each and every job that you're applying for, and is your CV relevant to that job? When I talk through this talk, most of the medical job applications probably really want more of a resume, so very specific to the job you're applying for, but I do use CV, the terminology CV. So at the end of the day, it doesn't really matter, but most of the time, people probably do want a resume more than a CV. But in this talk, I talk about CVs lots. It's just a term I'm used to. So general tips, be aware that employers spend roughly 6 to 8 seconds reviewing each CV. Now, this is really important to remember, because what you want to do is you want that front page to be the opening statement. You want them to look at your front page, spend 7 seconds looking at it and say, yep, they're going into the interview pile. So pay close attention to what you put on that front page. Everything that is good about you needs to be on that front page. Everything that is going to set you aside from others needs to be on that front page. So tailor your CV to the role that you're applying for. The best way to do this is to put a career statement or a career summary into your CV. If you haven't yet got a career summary in your CV, I'd strongly encourage you to look up how to write one and to get one in there. And I'm going to go a bit more into a career summary down the track. Make sure your name's the biggest thing on the front page, because that's what you want them to remember. Start each section with the most recent activity and work backwards in time. Generally aim for 2 pages, but so most of the time we just want a 2-page CV. That's, that almost pressures you and pushes you into getting the most concise and relevant information into 2 pages. The employer might stipulate what length they want, but if they don't, try and stick to 2 pages, particularly if you're at the start of your career. And include only relevant information. Don't include unnecessary information like marital status or health status, because that can introduce unnecessary bias. Always check spelling and grammar. Always. I have some horror stories about spelling and grammar that with spell check not working. You need to make sure that you're manually checking as well, just in case that your spell check doesn't work. Always check spelling and grammar. Probably the most important thing to remember. Make sure that you check your junk mail box, your others box, and your spam box if you've submitted your CV and you're expecting a response. Because so many of these large organizations that you might be submitting your CV to, or large healthcare organizations, a lot of them will have automated email responses, or emails like info@ or no reply at. If you've got really strong filters on your emails, very frequently they go straight to spam or straight to others, and you won't even realize that you've got an email from that organization. So I always say, whichever organization you're applying to, if they have a generic email address, make sure you put that generic email address in your email system as being important. Check your phone messages and make sure they sound professional. Heard some horror stories about that as well, about people having these really unprofessional phone messages, getting a call to tell them that they've got an interview, and that's the first thing that the potential employer hears. Check that you've asked your referees to be referees, and remind them as well. So this is what tends to happen, and I see it a lot, is that people often wait till the absolute last minute to ask someone to be their referee. And that puts unnecessary stress on you to be thinking, oh gosh, who should I ask to be my referee? Who have I worked with the last few years? Who's going to give me a good referee? And often what can happen is, if you're going to ask someone that's supervised a lot of medical students or a lot of junior doctors, they might potentially not remember exactly who you are from 2 years ago. So if you've been working with someone, you know the term's gone well, you know you had a good relationship with that supervisor, and you're pretty confident they're going to give you a good referee, ask them they're there to be a referee. You don't have to be thinking about applying for a job in the near future. Just say to them, hey, would you be my referee in the future? And then when the job applications come up, contact them and say, do you remember me from I was your medical student in endocrinology in term 2 at the Townsville Hospital. I'm applying for a job. Would it still be okay if you're my referee? Avoid cluttered layout. White spaces improve readability. I know there's this temptation to try and make yourself look different from others by doing fancy things with your CV. Just remember, people only look at it for 6 to 8 seconds on average. So you want it to be readable. The people that you're applying to jobs under is a healthcare system. They don't care about pretty pictures and pretty graphics. They want to know why you're good at the job. Avoid big photos of yourself on the front page. This might introduce unnecessary bias. Now, this is the most common question asked when it comes to CVs. Should I put a photo of myself on there? And there are differing opinions. Some people would say yes. Yes, if you're in an industry in which it might benefit it. But in healthcare, I really don't think that a photo does any use. It takes up space and it introduces unnecessary bias. Convert. So be very conscious that what computer system you might be creating a CV or a resume on might be different to the end user. And what can happen is, once you submit it, if they download it, or if they do, if it goes into their portal, the formatting might actually change of your CV, which I've heard happen to an awful lot of people. So I always recommend converting it into a PDF. In a PDF, it can't be changed. So it's always going to stay in that same formatting. If the organisation specifies they want it in a specific document, obviously do that. But if they don't specify, make sure you have it in a document that it can't be changed, editing on the other end. This is an example of the white readable spaces. So you can immediately see that you've got a grey resume and a white resume, and the white one is just so much easier to read. I remember when I was younger trying to set myself aside, and I went to Officeworks and I got some pink cardboard and I printed a resume out on pink cardboard. And thinking back now, like, that doesn't do me any favors. You're applying for a position where intelligent people who have read through many CVs will be looking at your CV. They want to read about you. They don't want to look at a pink piece of cardboard. So I spoke a little bit about career summaries. And I'm going to go into those in a second, but this is just a really good example on this CV of a career summary. So I'll talk a little bit about how to go into it in the next few slides, but if you could just have a quick read of that, you'll see what I mean in a few slides about why it's a good summary. There's probably a pretty good chance you've already read how to read through it while I've been talking. So, order of the sections, what do we do? It can feel very confusing and overwhelming as to how to order the sections, but really it's fairly simple. In bold is what you pretty much have to include, and what's not in bold is optional. The optional stuff, include what you're good at. Don't just put in headings because you feel like they should be there. Put in the things that you've got skills in. Put in the things that you think you're going to be able to talk about. Don't just have multiple headings with like one thing underneath it. So details, we want to make sure that you've got your name, your correct name, your contact details, any registration. So if you've got medical registration or if you've got multiple qualifications, we want to see those up at the start of the resume. We don't want to have to go searching through your resume to see if you've got general medical registration. We want to know if you've got general medical registration, great. If you've got a fellowship, great. We want to see it at the underneath your name. Career summary is the next thing that I would strongly encourage doing. If you feel really uncomfortable about doing them, don't do it. But if you feel comfortable about spending some time looking into how to do a career summary, definitely put one in. Bear in mind, it takes a fair while to actually summarize a career summary, because essentially what you're doing is putting all of your skills, achievements, and aims into one little paragraph. So it does take a fair bit of editing and sitting down and thinking about what you want out of the job to make a career summary. So if you're short on time, you might find that a career summary is not beneficial, but if you've got time, spend some time doing it. Work history is the next thing. So in reverse chronological order, so the most recent thing first. Education history, most recent qualification first. When it comes to medicine, I guess if you've got a whole heap of small diplomas that you might have done since your medical degree, you probably want to make sure your medical degree is up the top. So your medical degree should come first, and then the reverse chronological order for those other qualifications. But if you've got significant things like a PhD or a fellowship, you want to put them up the top and your medical degree in the reverse chronological order. Registration and membership of professional associations. So that is if you're a member of Indemnity, or what your general registration number is, or any committee or any significant registrations that you might have. The next bits are the optional bits. So it doesn't matter what you put in there. I would say put in one that you can really prove that you have skills in. So there's no point in putting in a title on presentations if you did a 10-minute presentation in first year medicine on your time in rural North Dakota. If you're potentially taking up 3 sentences there for that bit just on presentations. If you actually do a lot of community service and you're on the Surf Lifesaving Club and you're on the netball committee and you do free anatomy tutoring for high school students, put that in there instead of presentations, because the tendency people feel is that you need to be putting academic things in there. So you need to be putting presentations or research or achievements that I've made. If you don't have a lot of those, don't waste the space. Show off what you do have, and that is that you're great at community service, or you speak multiple languages, or something else about you. So don't just fill space. And referees, got to have referees in there. Some applications will say, they'll say something like, no need to put in referees in the application. We'll call you if we want your referees, like referees on phone call or something like that. But if it doesn't specify that, always put your referees in. So this is an example how a nice CV layout looks. So name should be most prominent, as we said. Qualification summary. Now, this person doesn't have a qualification summary, but that's where it helps the person looking at the CV quickly determine whether you're even relevant, if you can get the job, if you've got the relevant things for the job. This is a really good place to put your registration number. If you don't have general registration yet, that's fine. Just leave it blank. Contact details. Be cautious. I don't think you need to put any social media details in there, unless if you're like famous on TikTok for doing videos on medical anatomy and you're going for a position that you think it's relevant, then include that in. But be very cautious, and I'm sure you've heard this time and time again, be cautious of your social media presence when it's coming to times of job applications. If you think that Facebook is not going to give you a favourable presentation, make sure you change your settings on Facebook so that people can't look at your Facebook. So just be aware that people do look you up online. And if you think there's something that is not going to look in a professional manner, probably first of all, maybe you probably shouldn't be putting it online, but make sure that you know what your potential employers is going to be able to see. Provide contact details. So make sure that you set a mobile phone number and a professional email. Also be aware of your email titles. Some emails, you might have made an email many years ago and it was funny and hilarious, but just be aware that this is a professional setting, and just think about if your email might not be that professional, it might be worthwhile creating a different email address or using a different email address. As I said, career statement. So they're called many different things. People call them CV summaries, career statement, career goals, or personal statement. It doesn't matter what you call it. Everyone pretty much knows what it is, but I like to call them career statements. So I say it's crucial. it's crucial in the fact that it's going to set you apart from other people, and it is a really good way to describe exactly what you want out of the job and why they should hire you. So it should demonstrate why you're a good candidate for the job by drawing on key items in your CV. You should also try to show how you can add value to the employer and try to set your career horizon 2 to 5 years in advance for the future. So that's the same example as what I showed you before. And that career summary is, 3 sentences, but very concisely, it tells me everything I need to know. I probably don't need to continue reading this person's summary. I've spent my 7 seconds doing it, and it's great. I'll put them in the interview pile. I've already spoken a bit about your work history. So they're most important in your work history. They want to know what you've done, and they want to see it in reverse chronological order. Don't waste too much time writing the details of the position. So this is another thing that I see very frequently people do, is they'll write resident at the Townsville Hospital, and then what they'll write under it is the jobs that they've done. They might say job involved, taking bloods, doing cannulas, being involved on ward rounds, and communicating with patients. The people reading your CV know that. So remember that who's going to be reading your CV are usually medical. So they know what the job of an intern is. What you want to be doing in this section is creating a narrative about what skills you have and what you learned as that intern and why you're better than everyone else to get this job, and weave that into that section. And that's what I'm going to show you how to do in a second. And the education history, if you've worked 2 or 3 jobs, you're already going to have filled that first page. So that's going to be on the second page, most likely. But it's still very important to have an educational history there. If you've got space, try and write a narrative under the education history. But if you don't, just be very specific about where you've done your education and what degree you've done and what degree you've done. This is just some examples of some beautiful looking CVs that are nicely formatted, good spacing. They have that narrative example underneath their professional experience about what they did in their job or what skills they bring to the job, and they've got their career statements there. So narrative, I've talked a little bit about narrative. What is that? What do you mean? What are you talking about, Ash? Basically what it is using the CV as an opportunity to show the potential employer the skills that you have and weaving them into that. So that is underneath, particularly it's useful doing it underneath your work history, about looking at the PD of the job. So what the position description of what they actually want you to do, thinking about, do I do that as an individual, or what skills do I have? And how can I prove that in my CV? So I know what they want from a worker because I've just looked at the position description and the job application, and I know they want communication skills, or I know they want procedural skills. How do I go about proving to them that I can show them that I've got those skills? So as I said, they usually know what duties you've done. So you need to put in the unique things that you do. So an example, perhaps you're applying for a special trainee position in emergency medicine, and one of the selection criteria is about fast-paced decision-making. So what you need to do is you need to look at that job, see the selection criteria, and actually read it, because a lot of people just apply for jobs without actually looking at the job position description or the selection criteria of what they're looking for. So look at it, get a highlighter out and circle what skills they're looking for. Think about a time in a role that you've done that you've had to use the exact skills that they've just told you that they're looking for. And then think about, how can I weave this into my CV? So, in your work history, you can say intern at Cairns Base Hospital 2021, required multiple skills, including teamwork, fast-paced decision-making, patient advocacy and knowledge. Fast-paced decision-making was a regular skill required during my rural relief term, where I worked as part of a small team responding to regular resuscitations. So instead of wasting time dot pointing there what you did as an intern, did cannulas, took bloods, went on ward rounds, in 3 lines, you've proven to them that you have the skills of exactly what they're looking for. This is another example. So I see this all the time. So work experience, intern at Cairns Base Hospital, and people list what rotation they did and the dates they did it from. So you can see that entire chunk of space could be used proving the skills that you've learned from that rotation. So, a sentence saying these are the rotations I've done, I received regular feedback about my skills in communication, teamwork, decision-making, knowledge, with all the assessments saying that I'm above average in these areas. So you've proven to that person reading the CV that you're above average in the things that they're looking for. And then formal feedback. So that's more proof that from staff and patients about the same stuff that they're looking for in a person. And then you can go on and say involved in an audit in my sexual health rotation, which I audited the use of doxycycline and the treatment of STIs. So then something, if you've got something significant that you did in that role, make sure that you write it in there. So you can see that's two totally different things, but I tell you who I'm going to put in the pile to interview is definitely going to be the person on the right. More tips and tricks, because as I said, there's so much that that you can learn. There's so much information out there, and there's so much improvement that can be done into most people's CVs. You do need to spend definitely a dedicated period of time sitting down and looking through your CV. Don't expect to get it done in an hour. It can take, I did my CV the other day. It took me like 7 hours to review it because I sat down and I thought about the skills that I specifically have learned, what job you're applying for, and how to weave it in there. So there's the North Queensland Regional Training Hubs have just launched a brand new career planning page, which has information all about how to write your CV and also interview tips. A lovely pro forma on what to include and what a CV should look like, and also some really cool videos on how to do it. So that's a great place to look. Now, interview skills. Tips and tricks on interview skills. Now, interviewing is really daunting. I know it is. Most people haven't sat an interview for a really long time before the first interview that they, people can go 10, 15 years without having an interview, and all of a sudden they get hit with an interview, and it's really, really scary. But I can tell you, with preparation and reflection on what you might think you might be asked about in an interview, you're going to feel so much more confident and calm in yourself. So people tend to get an interview and tend to put their head in the sand and just get so nervous because, as I said at the start, most people don't like talking about themselves. Most people don't like talking about their skills, their strengths, their weaknesses, why you should hire me. Most people are like, oh, I don't want to do an interview. But you can definitely tell when you're sitting on an interview panel, someone who has spent some time preparing, spent some time reflecting about what they uniquely bring to the job, and someone who has just kind of put it off into the last possible minute and then just came in and winged the interview. And some people wing interviews really well, but I'm here to let you know that there's actually quite many questions that you can kind of preempt that you might potentially be asked, or styles of questions, and then start planning for those. So some general tips: please research the hospital you're applying for. I know some of the times you might put in 6 applications and it might be really hard work to look at into every single hospital, but really important if you're applying for a training program, a hospital, to know a little bit about the demographics, know what they stand for, know how big they are, know if they have, rural catchment zones or remote catchment zones, know a bit about that organization, because you might be asked about it in the interview. They might say, tell us, why do you want to come and work for our organization? You need to know the answer. But B, you also, if you aren't going to get asked that question, it's also very impressive to weave that into some of your answers. You might be talking about a skill of yours in which you have particular skills in rural and remote medicine, and then you can weave it into there and say, I know that this hospital has a large rural and remote component, and I'd love to use that opportunity to use my skills one day. So that in an interview would look really good, just knowing a bit more about what the organization stands for. Know the prerequisites, requirements, and expectation of the role you're applying for. How do you know that? You look at the position description of the job. Pretty much every job has to have a position description. That's the thing, that when you are about to apply for it, it says the specifics of the job, the responsibilities of the job. Look at that, highlight it, any particular skills that you think are jumping out at you, and just know what the job's all about. Brainstorm what questions you might be asked. Once again, how do I do that? You look at the position description. If they keep saying that they want you to have skills in communication and problem solving, then maybe preempt that you might be getting a question that you want to be talking about your problem solving and communication skills. Know what you're good at, what skills you have, and what you want from this role. Now, that is often the hardest thing to figure out. How do I know what skills I have? Well, You will be getting told all the time. You probably just don't realize it. So pretty much everyone would be in medicine in particular gets end of term assessments. As a medical student, you would, as a junior doctor, you would. Many people tend to shy away from end of term assessments and think, I don't want to sit down with my supervisor. I don't want to know what I did well and what I did not so well. I just want to hand that form in to whoever it needs to be handed into and never think about it again. I want you to start thinking about ways in which you can figure out or find out what your unique individual skills are. If you've got a consultant or a supervisor saying to you, hey, Rebecca, great term, you were fantastic, and writing on the form, fantastic rapport, fantastic communication skills, and a really fast learner. They are skills that I would then expect you to be able to talk about in an interview. Areas of improvement, once again, most supervisors that are looking after you are experienced and will be more than happy to talk to you about your areas of improvement. And we all have areas of improvement, all of us. Every single person has room for growth and room for improvement. There's a pretty good chance you get asked about it in an interview. So if you can look back on end of term assessments or self-reflect on what I need to improve on, have a think about how you would structure that into a question, then that's really going to help you. Prepare some examples that fit the description of the role. So what I mean by this is you're going to have to talk about why you should get the job, or they're going to be asking you about you and your work experience. You want to be able to have some examples that you can talk about that is specific to the job you're applying for. So once again, knowing exactly what they're looking for in a clinician, and thinking about some examples of how you can prove that you have that skill or that knowledge or that interest or whatever it is they're looking for. So you can do this in advance. Sit down, look at that position description, look at what they want, look at the responsibilities, think about the job, and then think about examples of how you do that specific thing well. Because what happens is if you freeze in an interview, you can, if you've rehearsed in your mind or prepared in your mind an example, that is what you'll feel far more comfortable bringing out. So I've talked about this a fair bit about looking at the position description. So this is an example. This is a job, I think the Townsville Hospital maybe last year, an RMO job. So it specifically says here exactly what they're looking for. You know, responsibilities, they've told you what they're looking for, how you will be assessed. This is where you can start to look at this and say, okay, so they're looking for someone who has high level verbal and written communication and interpersonal skills. Do I have that? Yes, I think I do. Can I think about a time where I used my high level written verbal communication skills, and think about a time over the last year or 2 years or however long it's been where you can prove that you have those skills? You know, it's same, the sound theoretical knowledge, practical skills, and ethical behavior of a medical practitioner. Think about if there's an example of how you can prove that. So definitely go back and look exactly what they're looking for. Prepare specific examples, as I've said. Prepare a list of questions that you can ask at the interview. Now, people always say, you know, should I ask questions? It all depends on the feel of the interview. If you genuinely have a question like, you know, I've done a PhD in a past life and I'm really interested in research. Is there an opportunity to do some research in this role? Then this is a perfect opportunity to find out if the role is even right for you. But don't ask a question just because you feel like you have to ask a question. Ask a question if you genuinely want to know something about the role. You know, if you're really interested in education, you know, you could say, I'm really interested in education. Is there the ability to get involved in clinical education or teaching medical students in this role? But yeah, have a list of questions if you think you really want to know the answer. Practice your responses out loud. If you've got someone that can do a mock interview with you, please do it. It's amazing how before you get feedback or before saying it out loud, if you know, it's surprising how many times you might say ums and ahs and buts and have mannerisms that someone else might be able to say. Did you realize you do this? You know, I even had it today. Someone said to me, do you realize when you're talking you frown a lot? And I was like, oh no, I didn't realize, but now I'm conscious of that, and I prepare an interview to maybe make sure that I don't frown so much. Things like that. Make sure you're clean, tidy, appropriately dressed. That goes without saying, but just always be cautious and think about what you're wearing, I guess. And practice. You can't practice too much. Record yourself interviewing on a microphone, on an iPhone, play it back. pay particular attention to those buts, ums, and the length of your responses, because you've got to remember that you also want to remain relevant and concise in your answers. You don't want to waffle on too much. The question, there's some styles and some frameworks. So I'm going to take you through quickly. There are common questions that you might get asked or common styles of questioning. So this can help you prepare. And you might already know all of this, or when I talk it through, you might be like, oh, that's what they were trying to get out at my medical school interviews. So when I went through all of this, I was like, that's why they asked me that really funny question that at the time I didn't have a clue what it was about. So every question that is asked of you in interview has a purpose and wants to try and, find out what type of clinician you are, or if you're the right person for the job. So the 3 styles you'll probably get asked, and the majority of people ask these, not everyone, but the majority of places would do this, is general questions, behavioural questions, and situational questions. So as I said, the majority of interviews will begin with a general question. So they just want to get to know you, your motivations, your interests, your skills, why you want to work for them. So this is a really motivating question. They want to know who you are. And there's many different ways of asking a question when what they really want to know is who you are. And there's many ways that you can weave in there your own narrative or your own story to show your own skills and what you're good at. Great opportunity to showcase why you're the best candidate. A well-considered and delivered answer will set you apart, but remember to be concise. Because what quite often happens in general questions is people just give their work history. So they might get asked, tell me a little bit about yourself, and they'll say, oh, I'm an intern, or I'm a PGY2 and I've worked at the Townsville Hospital and I did this rotation and I did that and I did this and I really want to apply to the training program for these reasons. But you've then not used the best ability of that question to showcase your skills and why you are the best person for the job. So these are perfect questions to practice. Don't rehearse, don't make it sound really rehearsed. Practice slipping into that question why you're perfect for that job. So tell me a little bit about yourself. Why did you apply for this position? Who are you? They're very general questions, and chances are you're going to get asked that. What are your biggest strengths or areas that you need to improve or consider a weakness? They're really, really common. There's a pretty good chance that you're going to get asked those. Don't talk about a weakness that you haven't learned from. So always talk about your strengths and give examples of why you have those strengths. So I'm very good at communication skills, and this is evidenced by blah, 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 my end of term assessments, or being told by my supervisor, or good outcomes with a patient who sent me a thank you letter saying my communication skills are good. So if you've got a strength, I always want you to give an example as to proving how you've got that strength, because interviewers are going to hear, tell me about your strengths. I'm good at communication skills. I'm good at time management. I'm good at practical skills. And another skill. People very commonly just give you a list of skills. That doesn't tell me anything about you. That tells me you had to think about what I want from someone in a job, but it doesn't tell me why you have that skill. So if you're giving a skill, make sure you give a quick example as to how to prove that. And with a weakness, make sure you choose an example that you've either learnt from or that you've improved from, because when you give a weakness, it's really important to show a growth mindset that, one of my weaknesses is time management. And I found it very difficult from going from a medical student to intern in terms of the pace of the job. But what I've been doing is I have been implementing a system of blah, 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 blah to try and make me more organized, because they want to see a weakness, but they want to see how you've improved. And the rest you've probably read. So if you want to use a framework, some people just prefer to wing it. But if you want to have a framework, the CAMP framework is really good. And it's a good framework for the first 3 questions, probably not so much the rest, but there's a pretty good chance you're going to get asked a general question like the top 3. So that is clinical, academic, management, and personal. So clinical, any clinical background you might have, or clinical achievements, academic achievements you might have, management. So that's, if you've been on any committees or board work or education or voluntary work or anything that's kind of like different from clinical or academic. And then P, personal. any personal information you feel relevant. Don't chuck in there heaps of stuff that you're not comfortable giving them. Just put it in there if you feel like it's relevant. You know, if you're applying for the orthopedic training program, you might pop in there that you were a, elite athlete for the Australian soccer team or something along those lines. You don't have to use this framework, but I find that when you get asked the question, tell me a little bit about yourself, it's a lovely framework to prove to them that you don't just get focused on clinical, which is most people just get stuck on the clinical. Regional Training Hub's website have some great examples of how to answer general behavioural questions. So jump on the website and have a look. Sorry, general questions, not behavioural questions. So behavioural questions are the ones they're basically basing the questions are asked with the assumption that your past behaviour is an indicator of your future behaviour. So if you hear questions like, tell me about a time when, describe a time when, give me an example when, it's highly likely you're going to be asked a behavioural question because they want to know what you've done in the past and therefore what type of clinician you are or what type of student you are or what type of person you are, because that's obviously going to be a pretty good predictor of who you're going to be in their job. Important to always be truthful. So don't make something up. Just give a good example of what actually has happened to you. And consider an example in which you can slip into there all of the multiple skills that you have. So they're hard. These behavioural questions are hard, but there are going to likely be a couple of significant incidences or events or things that you've been involved in which you can think about, I had to use communication skills, I had to use teamwork skills, I had to have procedural skills, I had to have conflict management. Because if you can come up with an example that uses multiple, that needs you, that's, you can show that you've got multiple skills. If you get asked a behavioural questioning, like just tell me about a time where you had to deal with conflict, you can use that one example you've already come up with because you know that there's 4 skills you needed in that scenario. So you use that scenario. Or they might say, tell me about a time you managed a deteriorating patient. You can use the same scenario. Or that they might say, tell me about a time where you're involved in a situation where something went wrong. Same scenario. So when you're thinking about the examples for behavioural questions, think about something that which you could use across multiple different skills. The way you structure the answer, you can either do CAR or STAR. People have all heard of these. Doesn't matter which one you use, context, action, result, or situation, task, action, result. Just please don't forget the R. The R is the most important. What is the outcome and what happened at the end of it? Was there hopefully it was a successful outcome, and most of the time you want to be giving a successful outcome. But if it's not a successful outcome, make sure that it's a relevant example. So these are some examples of behavioural questions that you might find you get. And a great answer would encompass what the employer is looking for. So you've looked at that position description, you know what they're looking for, an example of how you manage a situation using those methods and showcasing the skills in the example. And the last question, these are the, I don't want to be, why did you ask me this question? This is awful. This is the one I remember from my medical school days, is a situational question. So these are assessing how you can analyze a problem, how you would intervene, and how you'd obtain additional information in the decision-making process. So these are usually ethical dilemmas, usually things that you might not have ever come across and hopefully don't have to come across ever again. And they're not expecting you to have a perfect answer for the question, because often there is multiple ways that you can go about dealing with these ethical or uncomfortable situational questions as a clinician. But they want to see the way your brain's working. They want to see how you go about dealing with these difficult situations. So, you're an ED resident, you're seeing a 35-year-old IV drug user who's got a forearm fracture. They're aggressive and they're refusing surgery. How would you manage a situation? Or you're a resident on call overnight, a patient's becoming very aggressive, verbally abusive to the nursing staff. They're wanting to discharge against medical advice. How are you going to manage a situation? A really common one is you've become aware that a fellow resident or a fellow doctor that you're working with is coming to work disheveled or intoxicated or not, coming to work late all of the time. What would you do? So you're sitting here and you're going, oh my gosh, I have no idea. This is really stressful. I don't know. And if you don't have a framework ready to go, it can get these situational questions can throw people in interviews. They can get really difficult and you can start to just sort of fumble and bumble your way through the answer. So there's different frameworks out there you can use, but a really good one is called SPIES. And so that is seek information, patient safety, initiative, escalate, and support. So if you get thrown any ethical dilemma, you've obviously, or any situational question, you've obviously got to think about the specific question and is there a specific answer, of course. But a nice way to think about it is seek information. You know, we might use the example of the IV drug user in ED. Well, before I go further, I would speak to the patient and actually ask them what's going on. I'd be wanting to know more information about why they want to discharge against medical advice. And I'd talk to the nursing staff or the other doctors, whoever's involved in their care, to see if there's anything else I don't know about the situation. P, patient safety. Next thing, you'd always consider patient safety. So, you know, I'd be making sure that the patient is in a safe place to go home or blah, 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 whatever it might be. Initiative, what are you doing to approach the situation? Escalate, does it need escalation? And who are you going to escalate to? This is always when you think about my supervisors or who's on call or my registrar, or who am I going to escalate it to? It might be nursing staff, it might be allied health, it might be your immediate registrar, but who's going to help me out with this? And support. So think about, you know, it's often an ethical dilemma. The individual in question that you're being asked about probably needs support. So how are you going to go about making sure that they've got support around them, or anyone else in the team? If someone's been verbally abused, how would you go about making sure that the nurse that got verbally abused is being supported? So that's a really nice framework to answering those questions. Final tips. Look at the resources available to help you prepare. There is lots of resources out there. North Queensland Regional Training Hubs has just updated their website, and I'll show you in a second, and it's fabulous. It has some really great resources and some really great frameworks. I'm involved and I am helping co-organise a conference in 2 weekends called Creative Careers in Medicine. It's the 14th and 15th of May, and we're doing sessions specifically on CV and interview preparation if you want to come along. I've been told that I can give you a discount code, which is MEDCP30. So I'll type that in the chat box, but you can get a discount on that, and it's a really good conference. There's like lots of if you're an AMA member, they'll have information on CV and interview preparation, and a lot of your medical indemnity companies do as well. Preparation equals confidence. Being prepared, knowing what might be thrown at you when you walk into an interview is going to really increase your confidence. Knowing you've submitted an awesome CV and that you've showcased your skills, that's going to make you feel really good about getting that job. Know why you want the job. So probably the most important, why do I want to work at this hospital? Why do I want this job? Why do I want to get onto the training program? And also see this as an opportunity to get to know your future employer and be relaxed. So, you know, it's not just try to not be so nervous that you don't use this as an opportunity to figure out who's on the interview panel, what are they like, what's the hospital like, what's the organization like, what's the training program like. So see it as almost like a two-way street, and if you can kind of see it that way, it's going to make you feel far more relaxed. So we'll head over to the questions in a section. So for those who came in late, my name's Ash Coxon. I run medical career planning, and if you want any more information or have any questions after this session as well, you can email me there, or my website's there.
Thanks, Ash, so much for your amazing presentation. It was fantastic. We're now going to open the conversation to questions from the audience, and we have already received quite a few questions. So Ash, I might just go through them if that's okay. The first one is, do you think it's wise for junior doctors or medical students to have a LinkedIn profile?
Yes, I love LinkedIn so much. Multiple reasons. My goodness, I could do a separate talk on LinkedIn. LinkedIn is your professional CV online. People are looking for you on LinkedIn. LinkedIn is your beautiful way of it's not a social media thing, it's a professional thing. So putting everything up on LinkedIn, the other beauty about LinkedIn is if you start to develop diverse interests or different interests in medicine, there's a section called interests in LinkedIn, and you can put in your own specific interests. So if you start to get an interest in, let's say, digital health and medical administration, you type in there digital health, medical administration, management. And what LinkedIn does is it's artificial intelligence. So when people then put their jobs, when employers are putting their jobs onto LinkedIn, they need to tag what specific skills they're looking for or things that people that are interested in these areas would have. So what will happen is you'll get an automatic email saying, hey, have you seen this job that's just been advertised for the digital health consultant for the Cairns-based hospital? So LinkedIn is good for people to look at your CVs and look at your professional CVs, but also for you to look for jobs. So yes. do it.
Awesome.
And I've got a free
Yes.
course on my website, on medical career planning website, on how to write a medical LinkedIn profile. So jump on there. And,
that's fantastic.
Yeah, how to go about writing your own LinkedIn profile.
Oh, thanks, Ash.
It's all right.
Okay, next question. The idea of a the Queensland Health template recommended for the RMO campaign outlines quite a bit of detail, more than 2 pages when you include research, prac history, courses, skills. Is it expected as you gain experience, become more senior, that you should keep it to 2 pages regardless?
No. So this is where the pro formers where they ask you to definitely put in separate things, that's going to blow it out. And that's fine if that's what they're requesting. If you can keep it to 2 pages, that's great. But as you become more and more senior, it's going to end up longer and longer. You probably don't want a 6-page CV, because as you get more and more experienced, remember the stuff that you did in the past is going to become less and less relevant. So I got up to a point in my CV where I remember one time I was like, I'm going to have to cross off that I was the netball captain in year 12 high school. You do have to go through that process of being like, when is this no longer relevant? And so the more senior you get, the more that you're going to have to review and revise and think about what's no longer relevant. But, if you're getting more senior, maybe 4 or 5 pages is still good, but I think try and keep it concise.
Okay. All right. The Queensland Health website has a CV template. Do you recommend sticking to using that, or have an entirely original template like the one you showed?
Stick to theirs. Either or, like if they have options, that then, if they say put in whatever you want, maybe put in a nice CV. But if they prefer and if they recommend that template, just use their template, because what you'll find is the people going through the CVs, they'll have an eye for what they're looking for. So these people are going to be, the administrative officers or whoever's doing the employment will be seeing 300 CVs in an application. So they know their eyes might go straight to work history on the same pro forma. So if they're specifying that they recommend that, do that. If there's no recommendation whatsoever and you're getting more senior in your career and you can put in whatever CV, please don't just cut and paste what you did for a Queensland Health RMO campaign. That's the best time to redo your CV.
Okay, perfect. Someone said, is it really necessary that your referees are in a higher position than you?
Depends on what position you're in. So if you're a registrar, if you're a consultant, your referees should be someone that supervised you and that's someone that's relevant to that position, and that's going to say something good about you. So if you're a second year RMO, you probably don't want a medical student being your referee. But if the medical student is someone who's done a PhD in the area that you're thinking of getting into, then by all means. So think about why you're asking them to be your referee. But majority of the time, yes, it probably should be someone that supervised you or someone that has some kind of seniority in the organisation, if you can.
Yeah. Okay. What about advice on preparing cover letters? Do you have a different session about that, or?
Yes, cover letters. I'm just trying to think of whether that's on the Regional Training Hub's website. I think it might be.
I think it is too.
I'm pretty sure there's a page on there for cover letters as well. Yes, there is. So yeah, there's a page. I remember now. Yeah, definitely. There's a page of cover letters on the NQRTH website. Oh, there you go.
Perfect.
How to write your cover letter.
Oh, excellent.
So yeah.
Everyone can refer to that for the cover letter. Yep.
Yep. So sometimes you'll get asked to write a cover letter and sometimes you won't. If you're going for a high level job in which you think you've got something that you can really set yourself aside and apart and really prove that you're for the job, submit a cover letter anyway. There's no harm. You can, even if you write an email and attach your CV, if they want an email application, just write in structure your email like you would structure a cover letter and attach your CV.
Thanks, Ash. Someone has also asked, can you please restate what the discount code is for the Creative Careers in Medicine Conference?
I'll write it in the chat box.
Yes, that would be great.
Med CP30. So gives you guys 30% discount. Very good.
That's a good discount, 30%.
So I'm helping co-organize, but I'm also sponsoring a couple of sessions. So that's why I'm lucky I get a discount code. But it's going to be a fabulous conference. It's not just going to cover non-clinical or non-traditional careers. It covers a lot of things like how to succeed in an interview, how to get onto board positions, medical administration, public health, like lots of different careers that are still medical careers, but people they're not that well known.
Yeah. Oh, that'll be really interesting. Thanks, Ash.
Yeah.
Someone else has also asked, in the work experience part of the CV, is it good to include a table of time durations of each specialties you have rotated in during the internship?
I don't think that really matters, because when you're applying for a job, most people know what internship is. So internship is essentially 3 core rotations, 3 core, you do your medicine, your ED, your surgery, which are 10 weeks each, and then 2 additional rotations. So anyone that's going to be looking at your job is going to know what internship means, if that makes sense. If you're applying for a job that, say, if you want to get into pediatrics, for instance, and you've done a pediatrics rotation, absolutely, you want to highlight that you've done a pediatrics rotation. But the rest, I think it's fine to write internship, Mackay-based hospital, and then 1 dot point and say surgery, ED, pediatrics, psychiatry, and medicine, or something like that. I hope that answers your question.
Yeah, no, that's good, Ash. There's actually quite a few more questions to be answered, but we have to start wrapping up. I just want to let everyone know that, because there's been quite a few questions about this as well. Yes, the session has been recorded and we will be sending it out to every single person that registered. And all of those questions that we answered live, as well as the ones that we couldn't get to, we'll be answering all of them, and we'll also be sending that out to all of you as well. So I just want to say a huge, huge thank you to Dr. Ash Coxon for her time and the valuable information that you've provided tonight about interviews and CV preparation. We've all learnt a lot. And definitely go ahead and register for the conference that Ash is hosting in the next couple of weeks. I just want to also let you know, before you all go, that next week our webinar is about medical research for doctors in training in North Queensland. That will also start at 6 p.m. next Thursday. North Queensland is a paradise for research for doctors in training. We have diverse and unique investigation areas. There's a lot of funding availability, and there's a high level of support. And that's just some of the highlights of completing medical research in this part of the world. You'll hear from senior medical researchers currently working and living in North Queensland, and doctors in training following a career in research. Learn about research opportunities and the facilities available from an expert panel. We have some great speakers. Registration is essential to receive the webinar link. And so if you can't make the online event, once again, if you register, we'll send you a copy of the recording. Once again, I just want to thank very much to Ash Coxon for her time, valuable input, and thanks for attending tonight. Have a good night.